Good afternoon. Welcome. Today we actually have a little bit of a modification to our presentation because Ms. Chrissy Lee, who is actually the lead presenter for this session, is out due to some family issues. So that we will pull this together. So along with me, we have one of our new staff people, Salem. Kebede. I have to really learn to pronounce her name, which is part of this presentation that we're going to talk about today, cultural considerations in learning how to pronounce people's names correctly. So I'm Dr. Almeida. I'm the Director of Behavioral Health Services. Most of you probably have seen my name. I've worked in this field for many, many years, 37 years. Always working in the public sector, schools, community mental health, and I'm the Director of Behavioral Health Services for Fort Bend County. We in Fort Bend County are very fortunate that we have a Behavioral Health Services department. We work alongside our other county departments, Justice Partners, Health and Human Services, and Public Defender's Office. And together we really try to address the mental health needs of those in our communities, and especially those that come into contact with law enforcement in our court system. So you can find out more information about what we do and the variety of services and programs that we provide by going to our website, which basically, if you go to Fort Bend County Behavioral Health Services, it will take you to our website. On that website, you will also find out more information about many mental health activities, including some really useful links to the National Alliance for Mentally Ill, the Hogg Foundation, Mental Health America. As many of you know, May is a month that is dedicated to increasing the awareness around mental health disorders in our community. We all know mental health is prevalent. It's often the invisible illness, disease that impacts people that we don't see. And so there's been so much stigma associated with mental illness and so much stigma in different cultures. And I think we have to really be aware of that. And we're going to talk a little bit about that. And so a lot of what we're trying to do is by increasing the awareness, increasing the education about mental health, that mental illness is a disease, and that we need to be able to identify it, and then we need to be able to connect people with the appropriate services and supports. You'll also hear us talking a lot about social determinants of health, which really we started talking about this several years ago, and because there was some significant research that came out of the Center for Diseases that basically, in the World Health Organization, that basically said there's a variety of other factors that really contribute to health outcomes, including mental health outcomes, including whether people have a safe place to live, whether people feel safe in their environment, whether there's social supports, whether they have access to healthy foods, whether they have a support system, as I mentioned. All those things are so critical. And so, in mental health, it's really important to think about, what are the symptoms that we're seeing? What are the cultural issues that are going on with the individual, with their support system, with the provider system, and then also really looking at these social determinants of health. And truly, that's how I feel that we can make a difference. It's really looking at all of those issues together. So again, that's why those partnerships are really critical with the justice system, with Health and Human Services, with social services, community organizations, and of course with people with lived experiences. So that was a very long introduction, but hopefully that provides a context about why we do this work. I also would encourage you that to look at our website, and we will have 4 more of these throughout the month of May, including some discussions on early brain development, compassion fatigue, children's mental health, and I believe the last one is on coping strategies. So to hopefully provide some tips of how to cope with the increased anxiety that a lot of us are feeling, as well as the increased depression that we're seeing among many of those in our community. So this is about cultural considerations, and my goal and our goal today is to really, I guess maybe a couple points that, in kind of the takeaways from this. And I've had to learn and recognize and accept how little I know. And even though I've been working in this field for so many years, there are some things that unfortunately I've taken for granted. And so I need to relearn, and I need to listen, and I need to better understand issues around culture. Because one of the things is we're not all the same. So often we can think of, well, we're going to make sure everybody gets the same thing because that's fair, but we're not all the same. So we all don't need the same thing. And I think there's been some really exciting discussions about the difference between equity and equitable, or equal is not equity. And I really think that those are important concepts for all of us to remember. And really this discussion about we are not all the same, and then really having to have those often difficult conversations and uncomfortable conversations to better understand how individuals have gotten to the place that they are. Both our clients, individuals that we provide services to, but also ourselves. And for me, the staff, the workforce that works in this field. I really love this kind of changing the narrative and thinking about, what happened to people. Nobody chooses to be involved in the legal system. Nobody chooses to have a mental health disorder. So it's really important to have that discussion with individuals to think about what happened and how did you get here? And then really develop that relationship and, where you can connect and have really that understanding of how they got to where they are, how we all got to where we are. Because that's a really important part of our history, the factors that contribute to who we are, the factors that contribute to some of the decisions we make, and the factors that contribute to some of the stigma that we have around mental health, and often the reluctance to seek help. So as an immigrant coming to this country, I grew up with a very strong work ethic. You go to school, you work, you don't depend on government resources. You just keep working and going to school and things will get better. That's a very immigrant philosophy from my country and from many years ago. But that definitely has influenced who I am. And again, what I bring to what I do, both good and bad. So I think that's really, the importance of that. I wanted to also emphasize, the psychological safety. One of the things that COVID has definitely impacted is our ability to feel safe, our ability to emotionally regulate, our ability to deal with unpredictability, maybe a lack of control in our lives, in our environment. So, don't think a lot of children, a lot of individuals don't necessarily feel safe. And you have that compounded by a war. that is going on, and definitely cannot be ignored in how it impacts all of us. But psychological safety and feeling safe is such an important concept because we have to have that in order to be able to connect with another individual and to maybe help them feel safe. Or at least we need to be aware of where we are and struggling with that. I heard one time from an educator, we can't, this was after Harvey, and we all know how Harvey impacted our community. Basically, it was like, teachers can't give children what they don't have. And I think that applies to clinicians and really applies to all of us. If we're not feeling safe, if we're so hyper vigilant, if we're so on the edge and worried, how do we really help others, especially those that have a mental illness who often need some specialized interventions to develop those feelings? So again, I think it's really important, again, to think about what's happened to us, what is happening to us, being aware of that, having some self-reflection that I think is really important. And then, of course, thinking about what has happened to those individuals that, we're providing services to, trying to engage in services, really important considerations. So, okay, I think I talked about a lot of stuff that I'm going to turn it over to Salem, and we're going to go through some of these slides. There's a lot of information, so we're not going to go through all the details. The PowerPoint will be available on our website, so you can access it. And again, I think if you have questions, you can put them in the chat. And, really, this is much more of a dialogue. And it's something that we need to continue to discuss and be comfortable with the discussion and really acknowledge how little we know, that cultural humility that I think we've all recognized, especially I have, especially in the last year. So, Salem?
Good afternoon, everyone. Well, thank you so much for joining us here. And thank you, Dr. Almeida, for pretty much explaining what we're going to be sharing here today and in regards to how it's going to be relating to the work we do and how we relate to the people in our community. A little bit of introduction about myself. I am a mental health clinician with BHS. I am fairly new with this department, but I've been in the mental health field for over 10 years. And I am very glad, I'm very grateful to have this opportunity to be able to contribute in regards to the mental health education and fighting on the stigma when it comes to mental health. All right, so we'll go ahead and continue with the presentation. And like Dr. Almeida said a few minutes ago, there's a lot of information on this presentation. We're not going to be going through all of the details, but at the end, we'll provide information in regards to how to access that information. All right, so what we're going to be exploring this afternoon is pretty much like how Dr. Almeida explained: culture, race, ethnicity, and cultural identity in regards to how that affects our relationship among each other, but also our well-being in general, not just the mental, but psychological well-being. Also, we'll explore a little bit about how do we improve our cultural competency and humility, and also considerations that we need to take when we're working with multicultural clients. So we'll look at it from the different angle, client versus server, but then at the same time, peer-to-peer, because even though we are mental health providers, we're the part of the community here. And like it was mentioned earlier, our own identity also makes impact in regards to how we relate to other people, the people that we serve mainly. All right, culture, race, and ethnicity. Culture, as it's listed here, it's a dynamic force that often influences clients' response to treatment and the outcome of the treatment, the level of engagement, how they interpret their experiences, what they bring, what they're willing to share, and what they're not willing to expose and present when it comes to mental health treatment. So when we have that cultural humility, when we have that sensitivity to other people's culture and identity, what it does for the treatment in regards to mental health treatment specifically, it does create that greater credibility to the provider. We are able to get that satisfaction from the client. When we see clients for who they are, not only that relationship itself, that they are being seen and not judged, that is the part of the treatment, the huge part of treatment that will be able to make significant impact in regards to how they deal with the problems that they're facing. So it does allow the client to disclose the information about themselves, and it does also create that willingness among them to stay engaged in treatment, to do their part and take an active role in their recovery. All right, in the next couple of slides, we're going to be differentiating between race, ethnicity, and culture. Race is a social construct that describes people with a shared physical characteristics. Why is it relevant to mental health? Well, it can have tremendous social significance in regarding behavioral health services, social opportunity, status, wealth. Dr. Almeida shared earlier, there is a lot of different contributing factors that needs to be taken into consideration when we are in the place of providing treatment to mental health. So what kind of social environmental situations, psychosocial stressors that are adding to people's well-being, the clients that are in front of us. Major racial groups designated in the U.S. Bureau, these are not the only ones, but these are just a few. African American or Black, White American and Caucasian, Asian American, American Indian or Alaska Native or Native Hawaiian. Again, like I said, we're not expected. I think a lot of times the fear that comes from majority of us, at least from my end, is this assumption that we have to know it all. Like we have to have a good understanding of that client's perspective, where they're coming from. But rather, as it was mentioned earlier, it was just having that humility, willingness to be able to say, who are you? Explain yourself to me. Show me who you are. Tell me about yourself. So I wanted to emphasize throughout this presentation that the goal is for us to have that willingness and openness to explore, to get to know people, to have that conversation that makes us very uncomfortable among ourselves, but have the willingness to sit there and hear the client's experience from their point of view. All right, ethnicity, social identity and mutual sense of belongingness that define a group of people through a common historical or family origin, beliefs, and standards of behavior. How does it differ from race in that group? Just because people can share the common racial ancestry, it doesn't mean that they share that ethnic identity, meaning that, as it's listed in there as an example, Caucasian could be that bigger umbrella in a sense. But when we talk about Irish, Italian, we're getting into the specifics rather. Just because, like it says, because Latinx can belong to a number of races, the Census Bureau itself defined them as an ethnic group rather than a race. So like I said a few minutes ago, it's just a matter of trying to determine. And even though somebody identifies themselves as Latinx, it doesn't mean that they share the same qualities or perception like somebody from that same background. We'll talk a little bit about how assimilation kind of changes people's experience and ways of perceiving their own life and presenting themselves. Cultural identity. This is individuals' affiliation or identification with a particular group or groups. It arises through that interaction of individual. And then culture over the life cycle. What does it mean? Culture over a life cycle means that as we grow through our experience, as we grow through the different environment in our life, the different places that we go through, the different experiences we come through, our change and perspective will change. So like I said, being able to adapt to that change that comes along the way. So it's not all people, regardless of race or ethnicity, they develop that cultural identity, but it's not the same as it starts when they are a child and growing to a young adult and becoming an adult. It changes with the experience. So take that into consideration when working with multicultural clients. Language and communication. It's pretty much determine what we do with the clients in regards to how people, what kind of language they use, how they communicate their symptom. So language is a key element in culture, but speaking the same language at the same time does not make two people share the same cultural beliefs. They can be sharing the same cultural belief, but their language and their expression, the way they communicate, their style of communication could be totally different. So having that awareness within ourselves, And being open, again, I think I will keep going back to that very same point. Not having that expectation of, rather than trying to put them into the category, trying to get them to know for who they are, what they bring, what changes that they have come through. Geographic location also makes a significant impact in regards to how people interpret their experiences and they interact meaningfully with one another. Norms could be less related to a race, ethnicity, and more so related to the culture associated with their geographic location. I'll say to myself, like, I'm originally from East Africa. When I was there, it was more conservative sort of lifestyle. Mental health is not something to be spoken about because it has a different meaning. And it's pretty much deemed, you cannot bring that. And then actually it's seen as a weakness. Like if you were to say to somebody that I'm feeling depressed, they relate that to, you don't have a good relationship to God, because if you do have that good relationship with God, this is not going to happen. So there is that stigma that's along with that. But I transitioned and I've been into the US, so I've been exposed more. I learned a lot from my experience and having to do this work for a very long time. So definitely I made that shift. All of us at some point in our life will go through that time where it could be overwhelming. We need that support. So having to be able to make that transition myself lets me know that this is very possible. It doesn't matter how rigid it seems. If we allow people to be seen as who for that experience that they bring along the way, they can definitely make that change. So that geographic location really makes significant difference, not only to get to know who they are, but what kind of experience did shape those people's perception in general. Just because they changed that geographic location, what has changed? So having that willingness to ask, what is it about you that you feel like has transitioned to this point? What is your level of understanding, your perception, and how do we go and work towards the goal that you have for yourself? At the end, it's about identifying the client's goal. But if we don't understand that cultural background, we won't be able to know what's acceptable and not. I think all of us can relate. What I consider to be appropriate might not be fully considered to be appropriate or normal to other people. So we won't be able to see things from the client's perspective unless we have a good understanding of where they come from and what their perception and understanding of their experiences. Like I said earlier, we won't be going through a lot of these details, but this information will be available to all of you to review. Family and kinship. Families are important in all cultures. But again, the relationship among family will determine even not only the kind of treatment, but the outcome that we're looking for, the clients are seeking in regards to that treatment, what kind of treatment modality to use and how to approach that. So that is as we all know, when we're working with people with mental illness, support is the biggest piece of the recovery. So being able to understand, how does that person see family? I know, again, talking from my experience, I came from a culture where if I get sick, the whole family gets sick. Like the whole family embrace what that experience that I have. So in regards to treatment, if I wanted to get some help involving my family, will be able to give me a better outcome than just trying to work with me. But like I said earlier, having to transition through that experience, I came to the US, and here everything is more individualized. It's all about, majority of the focus is on that individual self rather than the group. But like I said, this is just one example, but just to kind of show that how family makes significant impact into our recovery and in what way can we involve the family. So being able to understand, what does family mean to you? Asking that question, in what way can they support you? How can they contribute to your recovery? So that's definitely a big factor. Gender roles. I think I'm going to go to the way at the bottom where it talks about what is acceptable when we talk about gender roles. What's acceptable for female versus male? What's considered to be normal? Again, there is a lot of cultures to where that men were considered to be the head of the household, to where that they take a lot of responsibility, to where women don't have that authority to be able to do that. So having to walk into experiences like that, if we don't know that gender role, it would be able to affect the treatment that we're trying to prepare or the treatment that we're trying to deliver to the client. So and then even when it comes to substance use, a lot of times different culture, there are some cultures where women are not allowed to be even present in when it comes to have that experience when it comes to substance use. But then there are other cultures where female join male in regards to having alcoholic beverage, and that's considered to be normal. So being able to know, having that awareness of what is their level of understanding, what is their perception when it comes to substance use, not just mental illness, because substance use is the big part of that mental illness as well. In what way that gender role makes impact in regards to, again, their level of understanding of the problem and creating a plan. Socioeconomic status and education. I think we can all relate to this. Mental health, it takes a lot of education, psychoeducation, right? So it all depends on what level of education that persons have, their socioeconomic status. If they are, like how Dr. Almeida had mentioned earlier, people who live in poverty, people who does not have their basic needs met, if we were able to bring mental health and trying to get them to explore other things that are not within their reach, we're not going to be able to address that. So we have to come back to that basic level. So taking the education, their level of education, that awareness of what was going on, and also the socioeconomic status into consideration. Health disparities, the difference in the incidence, prevalence, morbidity, the burden of the disease, and other adverse health conditions that exist among the specific group are determined by those two things: socioeconomic status and education. So they are the social determinant of health, because conditions in the environment in which people are born, live, learn, work, play, worship, and age that impact the wide range of health, their level of functioning, the quality of life in general, both the physical as well as the mental well-being. So the one point that I wanted to make before I move forward is that, as you can see, culture is a little bit of what makes us who we are. So having that understanding to ourselves and being open to explore other people, being open to see them for who they are, will be able to make our job even a lot easier. We'll be able to tackle the mental health stigma. May is a mental health month. Part of what we're trying to do is create this awareness. I expect people to come out and open up about their mental illness when we're not willing to see them for who they are. So I think this is a huge part of what we're trying to do, having awareness in our differences and being able to have that humility to bring us all together. So we, as a community, we can be able to grow and get better. All right. So I'm gonna let Dr. Almeida come in for a little bit here.
You're doing a great
ready?
job. I don't know, I might just let you continue. I mean, thank you so much. Okay, where's the clicker?
You just, no, right, that's right.
Thanks. Sorry. See, I can't even get, hold on. We're having some technical difficulties, it seems like these days.
That's right. When you're ready.
Okay, thanks. Okay, so we're going to talk a little bit about cultural competence, and really, one of the things I want to emphasize is, as Salem had mentioned, this cultural humility, and what is cultural competence, and in being able to work with kind of multicultural groups. So, when we started getting federal grants years ago, there was this whole thing that we had to check it off whether we had cultural competence training. And so what I like to say is that this is really a lifelong process. It's not something that we can just check off and say we've done this. It's really, how do we continue to engage in the discussion? And as Salem mentioned, often that difficult discussion about recognizing what we don't know, and then this ability to listen and to understand, and again, to have that difficult discussion. For me, that's been the really kind of that challenge and that importance. And so for an organization too, this is an ongoing process. It's engaging with staff and engaging in these conversations around equity, diversity, inclusion. Because as Salem mentioned, she's much more organized with the presentation than I am, but as she mentioned, race is really important. And so for many years, we thought, diversity, okay, we got to make sure, our workforce is representative of, different races and ethnicity and so on. But it's more than that for me. It's about making sure that those individuals with those differences, that we understand what those are and that they feel included in the organization. That's really, really important. Salem mentioned a couple of things about the questions that we should be asking, tell us about yourself. Who are you? Really that discussion, who are you? How did you get here? What happened to you? Again, having, and it's a struggle because in the mental health field, we have a shortage of workforce. We're often in crisis mode. We tend to be responding to problems. So often we minimize that really important time of listening and engaging with the individuals that we're serving, and also with each other. Again, so cultural competence is not something you can just check off. It's something you need to engage in and continue that engagement and that understanding. So I think this cultural humility. And I think this is a really important thing. It's just, I think we have to have more humility throughout. In my training, when I was working with parents that had children with ADHD early on, I was very, very young. And I had to really realize, what am I doing here? I mean, these are families that are struggling. They have children, I have my PhD, but, I'm 25 years old. I don't have any kids. How do I connect? And I felt like I could bring value. But this is one of the things I realize. It's often the individuals that we're working with, they are the experts. I mean, they have so much information that can provide. So we have a better understanding of who they are, but they also have resources like as Salem mentioned, the family and the history and those family supports in their culture. That can be such a resource for the work that we're trying to do with them, alongside them. So again, I think this is really important, is that often clients are the experts in their own cultural journey, and us taking the opportunity to not just assume that we know what's happened to them, where they came from, what kind of oppression that they've maybe have experienced, that we know their culture because, they filled out our intake form and they checked off a couple boxes. It's very important to also not assume that because an individual might be of a certain race or ethnic group that, they're going to, not to make those assumptions because there's such variability again within those groups. I think that those are really important issues to consider. So improving the cultural competence, as we talked about, having this cultural awareness, assessing our worldview, and that cultural humility, being open to recognizing what we don't know. Dispelling some of the myths of sameness and that familiarity. Ooh, that's a hard word to say. But I think it's really important to think about that, not making those assumptions because our individuals fall into a certain race or certain groups that we have expectations. We really need to think about who they are individually. So really important issues to remember. In cultural identities, and again, I think this just emphasizes what we've been talking about, that individuals can belonging to the same culture are not monolithic. And so they basically, they have some shared experiences but they also have individual experiences. Again, I'm Portuguese. I mean, that is part of who I am because I grew up in that country. However, you know, that doesn't, there's some things that, you know, probably I like fish, you know, but, you know, there's a lot of other things that probably are very different from myself and other Portuguese. So, and then also my experience of um, acculturation and assimilation into the United States. You know, since I've lived here for so many years, how do those cultures blend? So I just want to, and then I am going to turn it back over to Salem, but I think this slide is really important. So I just wanted to spend like a couple minutes on this. And we're actually going to be wrapping up a little bit before 1 because somebody else has to use this room. But serving multicultural groups. So to be culturally competent means to understand the history of oppression experienced by marginalized groups in society. That's difficult. And that also means you have to be comfortable in having those discussions, which are often uncomfortable. Because for many of us, it's really bothersome. It's really sad for me to recognize what has happened to groups in our society, those that have been marginalized, and to think about the history of oppression that many individuals, many groups have experienced. But it's critical. It's really not an option until we understand what has happened to individuals and to certain groups. We really cannot be culturally competent and, in my opinion, be effective in engaging with those individuals. Again, I think it's imperative not to minimize or neglect their experiences of discrimination and pain. So, you know, as a licensed psychologist and as a clinician for many years, you know, we talk about boundaries. I don't know how good I am with those boundaries. Because at some level you have to connect, and you have to connect not only on a professional level, but you almost have to connect some level on a personal level. You do have to be careful with the boundaries. But again, you cannot minimize the pain and the experiences that many have suffered. And then again, thinking about, you know, as a clinician, we often diagnose and, you know, label what's wrong. You know, we do that with, you know, parents and children and, you know, forming diagnostic formulations and treatment. Really need to think about what are the cultural norms of the client. Now, I need to say that those cultural norms might still put children in danger. And so, you know, it is my responsibility, it is our responsibility to, you know, protect children and to make sure that individuals are directed to the right care and the right treatment. You know, Salem mentioned that in her culture, and I've had several discussions about this. For example, mental illness is seen, or where she was born, you know, is seen as a weakness. So in many societies or in many cultural groups, mental illness is seen as a weakness. And it's almost like, you know, you should pray about it. You should go to church more often. You know, you should just get up and do it. You know, you're being lazy. That's why you're depressed. And it's like, that's not the case. Mental illness are disorders that need treatment. So, you know, we have to think about that, what individuals' beliefs are and what they've been told most of their lives. That, that's why it's so important to educate. We know, faith is a very strong anchor for individuals. It's a very strong protective factor. Individuals that are connected with faith-based organizations, that's often critical to their recovery and to building resiliency. However, individuals that have serious mental illness, individuals that are struggling with depression and anxiety, even attention deficit disorder, need to get the appropriate care, where they can really get the specialized services and supports for those disorders. So it's critical. I mean, so all these things are really important. Your family is critical to your sense of well-being. Your physical health is critical to your sense of well-being. Your access to healthy food, feeling safe in your environment. For many, faith is critical to your well-being, but so are, appropriate services and access to services. Did we talk about SES, or is that in the next slide?
We did.
We did, yeah. So, Salem mentioned that a little bit about the social determinants of health and economic resources. And I think that's one of the things that we're really struggling with right now, and sort of a concern. So kind of the limited workforce that we have, limited access to providers. And so right now, in the mental health field, many docs are pretty much taking private pay. So they're not taking insurance, they're not taking Medicaid, they're not taking Medicare. So my concern about that is that we have increased barriers to care, especially for those vulnerable or more vulnerable populations. And so, and that's one of the things that at Behavioral Health Services we try to do, is fill in the gaps with some of those services with individuals that cannot get access to care otherwise. I mean, we're not a long-term mental health provider, but often what we're doing is responding to, the needs of the courts, of the justice system, and then actually providing some of those services for those individuals that cannot get into care somewhere else. And once we connect them to care, hopefully we can just kind of step away and serve other individuals. So that's what we try to do. Salem, do you want to wrap it up? And we have a couple minutes. We have questions
as
yeah.
well.
Yeah.
So I'm going to go very quickly through the rest of the slides so that just highlight some of the things, but we're not going to get into a lot of detail because we do have a couple of questions that came through. So we want to make sure that we have time and then just have a few minutes to kind of discuss any additional things that we come across. So this slide talks a little bit about what are some things to consider when we're working with African-American clients. Like we mentioned earlier, the family structure is very important. They do have flexible family roles. They do value education, but not often in systematic discrimination way. So just being able to have that awareness of what is more important to you. So like I said, they're very big on African-American people, or very much, they do have that religious background. They are very much involved in the church. If we're talking about how do you cope, who's your connection, who's your support, being able to have that awareness that church is the bigger factor in their family as well. So having that awareness will make our job easier, and then it does make the recovery of our clients move along faster than it usually would. Servicing, again, American Indian, the tribe is of fundamental importance. Again, they have a variation in family structure, which is not the same as the African American. Asian American and Pacific Islander, that collectivistic orientation, that hierarchy in the relationship. Who is the head of that household? How is the family relating in that family system? Who do I need to go to? Who do I need to include in the treatment goals and plan? How is this this person's problem affecting the other people in the family. So being able to have that awareness, they do have that academic and occupational goal orientation. I think Dr. Almeida mentioned how her upbringing was being taught of to value education, work very hard. How does that interpret into their life? So being able to have that awareness is a key. When it comes to Latinx population, that dear respect and affection among the larger network of family and friends. It's not just the individual that you treat, but it will be the whole family. So being able to identify this unique characteristics that makes them who they are will be very helpful. Arab American and Muslim, again, the family structure, the strong religious and spiritual beliefs, those are things to be able to take into consideration. I would like to say something very, very, I remember just from my personal experience, I remember working with someone from Jamaica for a while. He came to court, this was in Harris County, for possession charge of marijuana. People from there, they smoke marijuana as a religious practice. That's something that they do. So he has done this, he was close to early 50. He has done this his whole life, but he finds himself in the situation where he was not able to assimilate to the culture here. So even get him to understand that it was wrong was very difficult. But what I found to be very helpful with him was being able to get into his world. Tell me about that. How do you do it? And giving him an opportunity to share his experience, what that means for him, not to encourage him to continue to do that, but trying to get him to understand that is a part of you that you brought along here. But when we do talk about assimilation, there are certain adjustments that you need to make. But anyways, to get to the end of the story, it took him several tries of having to go through that substance abuse treatment, but I think it took about 5 tries, and this is like weeks long of treatment. But when he got to that place and he tested clean, and it was a huge celebration for him. So not because he dismissed that belief he has, that not because he believed that it was actually wrong. He considered it to be actually very herbal thing for him. That's his way of connecting. But the fact that he was able to assimilate, the fact that he was able to see the difference, the fact that he was heard and seen, the fact that his treatment, I mean, I'm talking about not just the mental health, but the probation, the people the court, being able to understand that, the fact that he was given so many opportunities to go through that and succeed at the end, that made a significant impact. So this is to give you an example that it's a very important thing to consider. It's not impossible. It's very, very much possible. But being able to see the light in his eyes at that time was just very joyful. So we can do this all together. I just wanted to give that example here. Multicultural counseling and therapy, like we mentioned earlier, what are we supposed to be doing to help them? What are some things that we can improve as a clinician, as a friend, as a sister, as a mother, myself? But what is it that I can do to be able to make that experience better for the people around me? Even it takes, we talked about assimilation. Not everybody in the family might have been able to assimilate well. So being able to have that understanding is a key. All right, here is the general synopsis of what we've been talking about so far. So when it comes to family in general, mental health, race, ethnicity, and culture, it does affect the way we communicate, how we seek help, how do we interact among each other, how much stigma that we come with, what is our level of understanding when it comes to mental illness, how do we cope, how do we perceive mental illness, how do I express my symptoms. I know we didn't get a chance to go through this. A lot of times people use either physiological way of expressing their symptoms or more of psychological way. We can take depression as an example. People can describe it as more of a physical symptom, whereas other people can be able to say, no, I'm actually feeling helpless, like using their thoughts and their cognition and feeling to be able to express it. So that's a huge, that makes a huge impact in regards to how they come to treatment, their willingness to come to show up, and most importantly, to be able to fight that mental health stigma. All right, the next couple of slides talks, I'm gonna summarize all of them because we're out of time. It talks about how about in a work environment, what's our level of awareness? How do we accept our peer? because this is not just the client, as we mentioned earlier, this is not just the provider and the client, but the peer. And then also, what do we bring as a mental health clinician? How much awareness do I have to my own cultural identity? In what way can that show off into treatment? So this is huge than just that client to therapist or provider interaction, but how do we relate to our colleagues? At the same time, what do I bring to the table? How does my perception of mental illness, my culture, my identity will be able to play impact? Because when we are there to provide treatment, we bring ourselves, we're human as well. So there might be a way that counter interference could be able to come into play. So having awareness, it goes back to the very same thing, having humility, being able to go there, having a little bit of awareness about ourselves, willing to learn, willing to allow clients to express themselves. So like I said, I'm just gonna go through them very quickly. This information will be available. There are some wonderful examples of what to say and not to say, even in the workplace or the people that we interact with in the daily basis, okay? So cultural humility is not just among clients and providers, but through our peer. This tells us a little bit about 5 challenges that as a mental health professional of color, that again, like I said earlier, what does it do? Coming in to deliver treatment to somebody else. Like I said, if you don't have a good awareness of what you bring in, it's very likely to have that sense of resistance that comes from you, not from the client's end. There's that question of, am I being perceived as competent? It's very important to work on our own cultural awareness, being able to have good awareness so that we know what we bring, so that it doesn't interfere with the treatment that we're trying to deliver, all right? So together for mental health, this says that how do we come together to be able to fight the mental health stigma? Like I said, it takes different aspects. As a friend, as a colleague, as a provider, I want us all to come together, understand that culture determines our well-being, mental health, so that we can work together to change our community, to improve our health. So now we'll go to some of the questions that we have. I think we're good in time. We're just right on it. If we're going to be able to answer some of these questions, we'll try. If not, okay. So the first question is, how can the I'm not sure what that stands for, BIPOC?
Oh,
BIPOC, professional counter feelings of guilt or fear and showing ignorance when approaching patients' peer of different culture. Just like I mentioned, I think that's the most important thing. It talks a little bit about the mental health clinician, the provider side of it. Like I mentioned a little while ago, having that humility. We are all human as well. I think in mental health field, a lot of time we think that we're just there to deliver service, but that's also a learning opportunity, a learning curve for us. Being able to acknowledge when we make mistakes. We teach people, be gentle with yourself, have compassion, but we're gonna have to be able to deliver that to ourselves, to be gentle, to have compassion, to take ownership, apologize, and move forward. Like we said, it's not a one-time shot, but rather being able to grow. It's a lifelong process. So the more awareness we have, the more we can be more compassionate with ourselves. And I will let Dr. Amida answer the next question.
Okay, I can see it. Okay. How has the Behavioral Health Services Department implemented cultural competence training with staff? Great question. So we are, Dr. Profile, do you want to talk a little bit about, I'll talk. Okay, we're just getting started. Well, you know, we're just getting started. I think that's, and it's a learning process. We actually have a small grant through Social Current, and it's called Texas Change in Minds Learning Collaborative. So we're one of 10 sites in the state of Texas, and it's really a fascinating initiative. It's really to develop a shared knowledge of brain science and race equity. And you know, and we're like, well, how do the two go together? But it's so important. It's like, because, you know, with early interventions in brain science, there's so much research that is out there that talks about what people need, what children need for healthy brain development. And then really how adversities have impacted brain development and the disproportionality that has happened, especially among marginalized groups and in certain groups. And we need to be aware of that. For example, the trauma, I mean, we know that in the criminal justice system, there's a higher percentage of African American males. We know, for example, we know that, what is it, 1 in every 9 children, 9 African American children have a parent that's been incarcerated, compared to like 1 in 58 Caucasian children. So again, we know, the research tells us that there's this disproportionality, that there's this, in terms of the adversity that are experienced by certain groups, and that impacts brain development. That puts certain individuals, certain groups of individuals at more risk for more negative outcomes, more involvement in the criminal justice system, poorer health outcomes, earlier death. And so it's really important for us to be aware of that. And so we have started these discussions about equity, diversity, and inclusion. And also, how do we create a place that staff feel valued, that they feel safe, and how do we work towards collective values within the departments? Yes, we are starting the work. So, what does action look like for Fort Bend County Behavioral Health Services to have greater cultural consideration? For example, is it a representation in professionals? Is it a required diversity and inclusion training for staff? Optional education opportunities? All of the above. I definitely, the required diversity and inclusion training for staff. So here's the challenge. We can make something required, but it's beyond that. There has to be a buy-in. It has to feel like it's important for staff. So, from a management perspective, yes, you can check off that somebody did the training, but how does it really impact the work that they do? And that really challenge. It's like, first of all, is the training relevant for everybody? Does it have meaning? And then how does it show up in the work that we do? And that truly is overall the goal. How does this really commitment to this equity, diversity, and inclusion show up in the work that we do? Can you elaborate on the relationship between substance use and mental health? Well, so really, really important. Many of you have heard about co-occurring disorders, which is, co-occurring substance abuse and mental health disorders, especially in the population that we work with, the majority of individuals that we work with are involved in the criminal justice system. Some of the research says that the prevalence of those co-occurring disorders is about 80%. So it is truly important to think about mental illness and substance abuse. There's been a lot of research about which one comes first, what contributes. They coexist. There's some research that says, often people self-medicate because they don't have access to services. There's been some research in the children's literature on that. What I can say is addressing those in an integrated manner is really where we can get the best outcomes. And that's a challenge. That's something we need to work towards, because it not only is it very difficult, but we have limited providers. It's difficult to engage people in treatment. Again, trying to address those variety of factors, but critical, very high percentage of individuals with mental illness have a co-occurring substance use disorder. Any other questions? And we are right at 1 o'clock. Thank you so much. And Salem, thank you. You did a great job. Next time you're on your own. And thank you all. And then you also have our website, and Next week, we have a presentation on brain development and I believe compassion fatigue, which I think we're, probably a lot of us could use these days. And then I believe what's the last two? I think it's coping strategies and in resiliency in children. Yes. So, and reach out to us. We'll have these posted on our website also. And thank you for joining us. Thank you.